This segment is sponsored by Center for Vein Restoration.
Well, today I'm visiting Center for Vein Restoration, Dr. Anuj Shah. Thank you so much for having us up here today. We're up in Germantown, and I want to talk about the important services that you offer here so our viewers are watching at home maybe can understand what is the Center for Vein Restoration all about.
Absolutely. So we here are experts in all things lower extremity and medical vein disease. As you know, or many of the viewers probably know, the veins are the blood vessels that are bringing blood back into our chest.
Okay.
As we get older, genetics, time, working habits, history of prior injuries, what can happen is that the veins in our legs drain blood slower, and that can then cause lots of different symptoms. Heaviness, aching, swelling, throbbing, burning, restlessness, cramping, all possible symptoms that we can start to suffer from.
So how would you first diagnose this? Is this something that folks come to you directly, or is this something you would see your primary care and they would then recommend to see a specialist?
Either way, patients oftentimes do get referred to us by their primary care doctor, their dermatologist, their podiatrist, and then sometimes patients come to us themselves as well. Either way is completely fine.
So as we talk about vein disease, you mentioned some of those symptoms. Is there a group or a portion of the population that may be more susceptible to this issue than others?
Sure. So medical vein disease is very, very prevalent. There's approximately 40 million patients a year that do suffer from this condition. The latest studies have shown that 1 out of every 4 adults actually have symptoms of vein insufficiency as well.
Wow. And the cool thing now is that the technology's come a long way, so the things you can do to help people heal themselves is a lot less invasive and a lot easier, not for you because you're the doctor, but it's not as involved, correct?
Absolutely. The diagnosis is extremely easy. We use an ultrasound, so there's no injections, no dye, no needles, an ultrasound to map out the blood flow through the veins. And then if a patient does need treatment, everything is all what we would consider minimally invasive procedures.
Okay.
So it's all done through a tiny little needle. There's no stitches. You can go to work the same day, drive out of the office the same day. It's very, very easy compared to what it used to be in the olden days.
That's good news. Well, March is DVT Awareness Month, and I first want to know what exactly is DVT and why is an awareness needed?
Sure. So DVT stands for deep vein thrombosis, commonly referred to as blood clots. Many patients, about 100,000 individuals a year, do pass away from a blood clot. So we try to remind individuals about exactly what a blood clot is. If you have unexplained pain, swelling in your lower extremity, especially after a long trip, travel, recent surgery, you want to get checked for a blood clot.
Okay, some very important stuff. Listen, if you call today and mention that you saw Dr. Shah here in this interview, you can get a free 15-minute vein consultation, so you don't want to miss out. If you think you're having any of these symptoms, come get the free consultation, get it checked out, and Dr. Shah will take care of you. Thank you so much for your time today.
Absolutely, my pleasure.